President Biden has tested positive for COVID-19. The White House says he has, quote, very mild symptoms. The president has been vaccinated twice against the disease.
John Moore, professor of microbiology and immunology at Weill Cornell Medical College, joins us now for more. Professor, welcome. Thanks very much for being with us. So, given that President Biden tested positive today, when might he have caught it? And when about should he start testing negative again?
Probably he would contract it within the last 48 hours. And I believe he was recently on a trip, so that would be one possible source. Testing positive at least a week in all probability, perhaps a bit longer. It depends on whether you're using a rapid antigen test or a PCR test. PCR test will detect positivity for longer, but may not indicate infectiousness.
Do you know, or do we have any idea what the variant the president might have gotten? And what do we know about the different variants that are prevalent right now? Like, he was traveling in the Middle East. Is he more likely to have gotten something other than what we're seeing running rampant through parts of the U.S.?
Well, that's possible that a foreign trip could expose him to a variant that's not common in the States. But the most likely eventuality is he's contracted one of the late Omicron variants, BA4 or BA5, which are highly prevalent worldwide and dominate in America. So it's not certain that he would have got infected on the Middle East trip. He has been out of the White House since he returned. So we just don't know. It's probably going to be never known. But most likely he's got an Omicron variant. And he will, of course, be getting literally the best healthcare in the world. And as a doubly vaccinated individual, he's highly unlikely to progress to severe disease. So he will face a week, perhaps, of feeling under the weather. I mean, the most common symptom that's being reported for these Omicron lineage viruses is a sore throat, which can be, quite a bad sore throat in some people. Maybe congested, just may feel under the weather, but it's unlikely that anything worse than that will happen. He's probably also receiving antiviral therapy, Pavloxid. That would be standard of care for someone in his age group and stature.
So I'm curious about what you can tell us with respect to BA4 and BA5, John, and transmissibility. What differentiates those two sort of latest variants from the previous variants that came before? Because as we saw in this photograph that was tweeted out by the president, he's not wearing a mask. Presumably there may have been a photographer in the room capturing that image. What do we know about BA4 and BA5 and how transmissible it is?
Well, my guess is the photo was taken with a long lens from a doorway that's probably tens of feet away. So I doubt that the photographer would have been deliberately exposed to anything risky. BA4 and BA5 are the latest in an Omicron lineage that started in around December of last year. We've been dealing with Omicron infections all year, and they were somewhat of a game changer because they're so transmissible. And one of the reasons they're so transmissible is that they have acquired the ability to resist virus-neutralizing antibodies, which are our major defense against infection. So these variants can now blow past the antibodies that are induced either by vaccination or by a previous infection or by both. Now, there's still some protection by these antibodies, whether vaccine-induced or infection-induced, but they're much less protective than they were in 2021 against the viruses that were then circulating. So they're much more likely to infect a vaccinated person than we were used to in 2021. And it's just been a progression from BA1 to BA2 to now BA4 and 5, and the properties have exacerbated each time a new subvariant has come along.
Is this a surprise how rapidly these subvariants have been able to get around these antibodies that people either built up through vaccinations or boosters? Or, I mean, heck, getting COVID multiple times, people thought, oh, thank goodness I've gotten it, at least I'm clear, and now they're getting it 2 and 3 and 4 times.
I mean, should people be masking up again, I guess, is the other question. From your perspective, as someone who studies these and who sees the effect that these subvariants are able to have on the body and how the protective kind of things that were in place before against the earlier versions of the virus don't seem to offer that same kind of protection now.
Well, mask wearing has always made sense. It's always been something that people should have been doing and should continue to do. And I'm working within the walls of a medical school. It's mandatory if I'm outside this office. I'm by myself here, so it's irrelevant. But if I'm outside this office, it's required that I wear a mask, and everyone does, because it makes sense. We have to protect each other and the patients who also visit the hospital. I wear a mask if I'm on the New York subway. I wear a mask if I go in a grocery store. I don't wear one walking down the street because that's a minimal risk. So we need to be aware. The virus has not gone away. The Omicron variants are circulating widely. The recorded number of infections a day in America is around 130,000, but we all know that's underestimated by a factor of perhaps 4, because when people are testing positive using at-home kits, they're not reporting their infection to CDC or the local Department of Health. That's not happening. So there's probably 500,000 Americans a day getting an BA4, BA5 Omicron infection. People want the virus to have gone away, but it hasn't. So there's risk in doing daily life. Now, but what has changed is that the vaccinations and infections that we've accumulated as a population have stopping most people from progressing to hospital and dying. The death rate in the States at the moment, which is well recorded, is around 300 to 400 a day, which is a high number. We shouldn't be blasé about it. But the peak in early 2021 was over 3,000 a day. So we're only at 10% of that. And I think people have just assumed, because there's a much lower risk of death, that they can relax their guard and seem willing to tolerate these generally at-home, relatively mild, but still unpleasant infections. No one should want to get infected. I mean, my daughter is recovering from an Omicron infection now. She had a very bad sore throat and still feels congested after a week, but she's healthy, she's young, she'll be fine. Most people will be, but you're still going to have, in all probability, not a great week if you get infected. So why take the risk if you can avoid it?
Why take that risk? All right, John Moore, Weill Cornell Medical College. John, thank you so much for sharing your insight with us. Chris Megerian is a White House reporter with the Associated Press, and Chris joins us now with more. Chris, thanks very much for being with us. So what can you tell us at this moment about how the White House is handling President Biden's COVID diagnosis? We saw earlier there is a tweet with the president at a desk and a message clearly wanting to project that things are going on despite
business as usual, or business as close to usual as they can get it.
He says keeping busy to close out that tweet. Chris, what can you tell us about the White House's approach here?
Yeah, I think that's exactly right. They want the country to feel like things are fine. They want people to understand that the president is doing well and that he's, taking care of business and that he's not been, laid up by this virus. There's also, that's partially a public health message. The president's been vaccinated twice, boosted twice. They want the public to feel like these vaccines are still effective, even if the Omicron subvariants can sometimes work around them because these shots prevent a severe disease. And they want the country to feel like it's still in good hands, even though the president has this virus.
And Chris, the president was supposed to speak about gun violence today. He's been discussing the economy. Now this, how would you think this diagnosis is going to derail the president's agenda and what he's been trying to get done, especially ahead of these midterm elections?
Sure. Well, definitely it's going to keep him off the road for a little bit. He won't be, speaking about gun violence today in Pennsylvania or attending a fundraiser in Philadelphia. He was going to spend a long weekend in Delaware. And then there was more trips, expected in the near future as well. So this could definitely push some of that back. If this continues to be a mild case of COVID, he'll likely be on the road and back to his normal activities, in a little more than a week. However, to send the message that, the country is moving past the virus, that's something that's a little bit more difficult after he gets it himself, given all the precautions that are put in place to keep him from getting infected.
All right, Chris Megerian. Chris, thank you so much. Let's bring in CBS News political reporter Caitlin Huey-Burns, joining us now from the North Lawn of the White House. So, Caitlin, we have been hearing about how the president is doing right now. We saw that picture of the president that was tweeted out not that long ago. What can you tell us about what's on the schedule today in terms of briefings? Are we expecting to hear from any White House officials today?
Well, we are going to hear from White House Press Secretary Karine Jean-Pierre in the 2 p.m. hour, so we will get an update about the president and his condition. But it is clear that the White House being here today, they want to project this image of the president at work, that even though he has had to cancel his events, he was supposed to go to Pennsylvania today for 2 different events. Those are, of course, canceled, that he is still at work. So even in the statement that was released announcing that he had COVID, they said that he will continue to be on the phone, that he'll be on Zoom and conducting business with these, quote, very mild symptoms. We also know that he has spoken with members of Congress from Pennsylvania and others with whom he was supposed to meet. Bob Casey, the senator from Pennsylvania, said that President Biden called him and said that he's feeling fine and that he hopes to be back in Pennsylvania at another point. But it is important to note that the president, was just on the road yesterday, and he had close contact with at least 3 senators, a couple of House members, a governor, and a variety of different staff. So here at the White House, they're essentially trying to do some contact tracing, trying to figure out who else the president had been in close contact with. And of course, he just returned from that trip abroad in Saudi Arabia just on Sunday.
That's right, Caitlin. We were talking to Jeff Mason from Reuters yesterday, who said he was on that tarmac speaking to President Biden. It was loud. He's a close talker. Chris and I have been on Air Force One sitting next to each other. We're talking to officials, talking to the president during that trip. It's not, as you know, it's not a lot of space in a lot of those places. So are you noticing today at the White House grounds, are you noticing any different protocols since you've been there? Are you seeing more people putting on masks, staff, reporters? What can you tell us about what you're seeing there?
Yeah, that's a really good question, Christina, because we were on air, most of the morning. And then when I walked back to that press file, which, as you both know, is a very tiny space, most of the reporters and members of the media were wearing masks. And that's because a lot of them were actually traveling with the president, as you mentioned just yesterday. We were talking a lot about how this feels so very different from when then President Trump got COVID. And Christina, I know you were there at Walter Reed covering that as well. We've, of course, since had the vaccine. The White House has been, reminding people that he's been vaccinated, been boosted twice. He was boosted last in March. He last had his physical in November. And this is a White House that just treats this very differently than the previous administration does. When we are part of the pool covering the president, we are required to take a COVID test, required, of course, for it to be negative before being able to participate in the pool. So the requirements are different. But, over the past, several weeks, that hasn't been the case. People have not been wearing masks here. People are vaccinated and boosted. But today feels different in light of this news.
And Caitlin, I wonder, as far as other officials in the West Wing, as far as the First Lady, what do we know about their own sort of COVID status right now, the Vice President? What can you tell us on that front?
Well, both the Vice President and the First Lady have tested negative. They are both also traveling at the moment. We know that the First Lady went to Connecticut while Biden was in Massachusetts. She is also going to continue her schedule. She's expected to go to Michigan and Georgia, and she's going to spend the night tonight in Wilmington. So she is continuing her schedule, and she spoke to the press earlier today, saying that she spoke to her husband and that he is feeling fine, and that she did test negative. Vice President Kamala Harris is on the road today as well. She's expected to come back tonight. She has also tested negative. And of course, the president's schedule is now canceled in terms of travel for the rest of the week. He was supposed to go to Wilmington, Delaware this weekend. And of course, he will remain here at the White House in the residence, isolating until he tests negative.
All right, Caitlin Huey-Burns on this developing story. Caitlin, thank you.